your assessment is that we're now to the point where we have the technological platform, the computational platform, the decision enhancement platform to integrate these things together in a way where we can move to this notion of quantitatively based, molecularly operating level medicine. That we're at that point now, and that you're working to try to break down the barriers to make this happen.
What's been frustrating, we've been at that point actually for 5 years. So why is this not happening? Why are we still getting these terrible outcomes, higher cost, terrible access, as you just mentioned, with really the poorest, for some of the poorest outcomes on the planet? So when you analyze this issue, what are the barriers? So if you take medicine as 3 buckets, the first barrier is this knowledge barrier, and the knowledge barrier is exploding every day. The second barrier is the delivery barrier, and the third barrier is the payment barrier. So let's just
delivery as in the healthcare provider.
Correct.
Right.
In terms of how do you as a patient have your records from the clinic to the lab to the x-ray to the hospital back to the home? How's information flowed? So if you look at each of these elements in its own right, on the knowledge side, we're gaining more knowledge now. I not only know that we're getting more knowledge in the last 5 years than in the last 50 years in medicine.
Knowledge meaning scientific discoveries, breakthroughs in tools.
Correct, of information that could
right.
improve your health. However, that knowledge, and the RAND study has shown, that knowledge transferred into patients takes an average of 17 years. For a cancer patient, we don't have that time. And specifically, if you don't, you actually know that you have months. So how do you break the knowledge barrier into the delivery barrier? When you get into the delivery barrier, you have what are called totally uncoordinated care with absence of transfer of information, and actually decision support that is totally poor. And then when you get a payment barrier, there's no what we call CPT code. When I, as a doctor or doctors, the only way doctors get reimbursed is actually to treat you when you're sick. There's no reimbursement to the doctor to keep you out of the hospital, keep you at home, and keep you healthy. There's no healthy code. So there is a code for illness. So there's perverse incentives. The only way the doctor can get reimbursed is do as much as he can to you when you're sick, and actually get no reimbursement to keep you healthy. And on the integrated side, you as a patient, there's no way of actually capturing your data and actually having a continuum of knowledge throughout the lifespan or health span of a patient. And on the knowledge side, there's no way of transferring knowledge to the patient in real time. Taken together, we have a great healthcare system, that we have no knowledge transfer, we have lack of integration, and we have actually lack of incentive to pay for better outcomes.